of movement, pressure are measured to evaluate for heart disease, for example. We need diagnosis is 60. So as our population continues to grow older, more people are likely to experience PD. In fact, people blood pressure are measured to evaluate for heart disease, for example. We need tests like that in Parkinson's, but they don't exist yet. Doctors diagnose Parkinson's by completing a medical history and a physical examination. They look for 2 of the 3 classic motor symptoms, which are resting tremor, stiffness, and slowness of movement. When people hear about Parkinson's, they mostly think of these motor symptoms, especially tremor. But some people also experience walking and balance problems, and PD affects other body systems. Constipation, sleep problems, cognitive changes, and depression can occur, sometimes even before a Parkinson's diagnosis. And some people report that they lose their sense of smell. One of the hardest things about Parkinson's is that everyone with the disease embarks on a unique journey. In fact, movement disorder specialists say, if you've met one person with Parkinson's, you've met one person with Parkinson's. Each person has their own mix of symptoms, and there is no standard trajectory or path. So if everyone gets their own version of Parkinson's, then what does everyone with PD have in common? To answer that, let's take a look inside the brain. In Parkinson's, the brain cells that make dopamine stop working or die. Dopamine is a signaling chemical, or a neurotransmitter, that coordinates movement as well as feelings of motivation and reward. When dopamine cells die, Parkinson's symptoms emerge. Exactly why these cells die is not well understood. Researchers believe that in most people, Parkinson's is likely caused by a combination of genetic and environmental factors. But although certain environmental factors, such as pesticides and head injury, are associated with an increased risk of PD, in most people there is no clear exposure we can point to as a straightforward cause of their Parkinson's. Similarly, while genetic mutations are linked to an increased risk of Parkinson's, based on what we know today, the vast majority of cases are not directly related to genetics. However, the field of genetics is moving fast. In Parkinson's, as in many other diseases, tremendous research is focused on genetics because this is our best opportunity to uncover paths to treatment breakthroughs. But how do we treat Parkinson's today? Here's what I told my own patients when I was a doctor in clinical practice. The currently available PD medications can't slow or stop the progression of the disease, but they can ease symptoms and help you continue doing much of what you have always done. The same goes for certain surgical procedures, which are a good option for some people. The most important point is that treatment regimens need to be individualized, so you should work closely with your doctor to determine what medication or combination of therapies work best for you and your symptoms. Speaking of doctors, our foundation urges people with PD to see a movement disorder specialist if possible. Many people don't get to these experts, and we'd like to change that, because the right doctor can help optimize your Parkinson's care, update you on research and drug development, and direct you to clinical trials, which are vital opportunities for you to advance scientific